Hello, this is the arthroscopy view of the left knee of Kevin Beresford. It's the 14th of December 2021, and it's David Barrett operating. So here we are in the patella femoral joint. It's quite a lot of fluid on the knee which we've drained. Just to orientate you a little bit, there's the undersurface of the patella or kneecap, front surface of the femur. Just to show you where you are, up here is the head end, down here are the toes. This is the outer side of the knee, and this is the inner side on which you have the cartilage tear. My probe is about 2.4 millimeters in diameter, so there's a good deal of magnification. The deal here is that we are going to look at the medial meniscal tear, but we're also going to look at the articular surface of the femur and tibia. So the smoother and softer that is, as white surface is, the better it is for your knee. So tiny bit of roughness on the undersurface of the kneecap, but front surface of the femur, really good, lovely and smooth. Okay, coming round into the medial, the inner part of the knee, you can see the surface of the femur still remains pretty good. And of course, that's why we decided to go ahead and do the arthroscopy, because the lining surface of the knee here is pretty good. Lining surface of the tibia is pretty good, and here is the medial meniscus on the inside. And you can see that's the shock absorber or washing the knee. It looks great here, and then we go here, you can see it's all torn up, and the fluid's a little bit yellow and inflamed, and you can see that's all torn there. So that's exactly what the issue is for you. And yet you still have good lining of the knee here. So we should be able to deal with that meniscal tear and keep you going on this knee for much longer. And then in the center of the knee, there's the anterior cruciate ligament running from the tibia to the femur. That keeps the knee together as you pivot and twist. And then we look on the outside of the knee here, femur here, tibia here, there's the lateral meniscus here. It looks really, really good. So no worries about that side. We just need to deal with that medial meniscus. So here we are back on that tear. You can see that we're right up against it now. We've got an instrument here that I can advance now and start chomping away at the damaged section. And that will create a little bit of debris as we just take away the damaged section, and then you'll see us hoover that up in a second. So you can see that the fluid's quite murky now, lots of debris in the joint. I've got a different instrument in there. It's got a little rotating blade there, you can probably see. It's attached to suction, so as I turn that on, you can see we can hoover up all the segments there, but also all the segments that I've clipped away. But also you'll see that we're tidying up all the floating debris in the joint and some of that fluid. So you can see the picture gets remarkably clearer. So just spend a little time cleaning up the edges of this meniscus now. Okay, so we've got rid of that little tear that was around the back there. It's quite a big extension that went around here, and we've got rid of that too. So really now we've got rid of anything that's getting caught in between these two surfaces of the bone, but yeah, the cartilage on them is still pretty good. So that's very encouraging. We'll actually take easy in a recovery, make a nice good